Welcome to the Ohio Attorney General's Training and Education Program for Naloxone, also known as Narcan. This program will provide current education on the opioid epidemic which Ohio is experiencing, as well as provide first responders and others with key information for the administration of naloxone. Under the Controlled Substance Act, drugs and other substances are divided into 5 schedules. Drugs are placed in their respective schedules based on their current accepted medical use in the United States, the relative abuse potential, and likelihood of causing dependence when abused. These legal opioids are frequently prescribed to patients for pain relief. However, their abuse could lead to moderate or severe physical dependence as well as psychological dependence. Opioids are often combined with other pain-relieving medications by manufacturers. The additives in these medications reduce the amount of opioid in the blend. However, these drugs still have a potential for abuse and can result in physical and psychological dependence. The most common illegal opioids in the world are opium and heroin. Opium is derived from the opium poppy. The plant is refined to make both legal and illegal opioids. Heroin is an opioid analgesic that, when introduced to the human body, converts to morphine. Heroin is classified as a Schedule I drug by the United States Drug Enforcement Agency. This scheduling means heroin currently has no accepted medical use in the United States. Heroin has a high potential for abuse. The use of heroin can lead to severe psychological and physical dependence. In 2013, there were more than 900 deaths attributed to heroin overdoses in the state of Ohio. Statistics in the state of Ohio show an alarming trend. According to the Ohio Department of Health Office of Vital Statistics, drug overdoses are the leading cause of accidental death. On average, approximately 5 people die each day in Ohio due to a drug overdose. Opioid overdoses are increasing at an epidemic rate. Heroin deaths are increasing in part because other substances are being added. Heroin dealers often use cutting agents to adulterate or dilute a drug before street distribution. There are numerous materials used as cutting agents, causing the user to often misjudge tolerance levels. Tolerance levels are often overestimated by individuals who have not used opiates for an extended period of time and resume their prior dose. Synthetic opiates, such as fentanyl, have recently been added to heroin to increase the effect. For example, fentanyl is a powerful painkiller and is estimated to be 80 times more potent than morphine. When heroin, alcohol, and other drugs are combined, the overall effect on the human body may intensify. These additives to heroin can increase the likelihood of an accidental overdose. Some of the signs and symptoms of an opioid overdose are pinpoint pupils, bluish tinge to the skin, limp body, pale face, slow or absent pulse, vomiting, passing out, and choking, gurgling, or snoring noises. In addition, breathing can be slow, irregular, or completely stop. The signs of an overdose can appear up to 3 hours after the drug was first used. This window provides sufficient time for intervention. A quick assessment of a subject experiencing any of these symptoms is imperative. The scene where a subject is found, along with information received from witnesses, will often provide clues to first responders and others that an overdose has occurred. Once an overdose is recognized, you should administer naloxone. Naloxone Hydrocholoride, commonly known by the trade name Narcan, is a drug that reverses the effects of opioids on the brain. When an individual overdoses on an opioid, the brain's trigger to breathe is effectively turned off and respiration stops. Naloxone displaces the opioid molecules, causing the individual to return to normal respiration. Naloxone has only one function: to reverse the effects of opioids on the brain and respiratory system, thereby preventing death. If it turns out the person you give it to is not experiencing an opioid overdose after all, administration of naloxone will not hurt that person. Ohio Revised Code Section 2925.61d was enacted by Ohio House Bill 170. It grants immunity from administrative action and criminal prosecution to a peace officer acting in good faith who administers naloxone under certain conditions. The peace officer has immunity if the naloxone is obtained from the law enforcement agency that employs the officer. The Ohio State Board of Pharmacy strongly encourages regular training on overdose response techniques and naloxone administration. Per Ohio Revised Code Section 4729.51, as enacted by Ohio House Bill 483, a law enforcement agency is not subject to licensure as a terminal distributor of dangerous drugs for the sole purpose of possessing naloxone. This change permits law enforcement agencies to purchase naloxone from wholesalers or other terminal distributors without a license by the Ohio State Board of Pharmacy. People other than first responders may also obtain and administer naloxone with a medical prescription. Those individuals may include family members and others. When the prescription is given, the doctor will instruct the individual to call for medical assistance when the drug is administered. The primary method of administering naloxone is a nasal spray. The drug is a small molecule that is easily absorbed through the nasal mucosal membranes. This method negates the risk of needle sticks to rescuers and increases delivery time to the drug. Ohio House Bill 170 only applies to first responders who administer naloxone intranasally or through an auto-injector in a manufactured dosage form. The Ohio State Board of Pharmacy has two requirements for naloxone administration and delivery. The Ohio State Board of Pharmacy strongly recommends the implementation of safeguards to ensure the safe use of naloxone in the event of an opioid overdose, including storing naloxone at room temperature and away from light, and disposing of a naloxone dose if it is beyond the expiration date or there are signs of discoloration or particulate matter in the solution. The board also strongly encourages regular training on the administration of naloxone in the event of an apparent opioid overdose. Here are step-by-step instructions on how to properly administer naloxone. Step 1. Once an opioid overdose is suspected, immediately verify with 911 that emergency medical service is en route to the location. Step 2. Assemble your naloxone delivery system by removing the protective caps from the vial and injector. Now thread the vial into the injector 3 half turns or until the stopper is pierced. An atomizer is a device that converts a stream of liquid into a fine spray. This device can be easily applied to the tip of the syringe by twisting on the top of the syringe for nasal distribution. In the event your naloxone delivery system is different than the one used in this demonstration, follow the manufacturer's instructions. Step 3. In the event an atomizer is not included, the tip of the syringe should be placed near or just inside the nostril. If the naloxone has not taken effect within approximately 2 to 4 minutes, a second dose should be administered. Individuals who have satisfactorily responded to naloxone administration may require additional doses before arrival to a medical facility. The effect of an opioid may last longer than the counter effect of naloxone. Watch an up-close administration demonstration of naloxone. Step 4. Now place the individual into a rescue position to prevent aspiration and to maintain an open airway. Place the person on their side with the arm closest to the ground straightened. Place the individual's head on their arm with the mouth angled downward. Bend the knee of the leg that is further from the ground and place the knee against the ground. When the naloxone takes effect, the individual will most likely take a large, deep breath as they return to consciousness. Keep the individual calm and safe until emergency medical personnel arrives. Watch a video of all the steps. If no reaction is noted within the first 2 minutes, a second dose might be required. Additional doses will not hurt the person. Naloxone must be kept out of direct light and stored at room temperature. The naloxone should not be subjected to extreme heat or cold, as it may impact the effectiveness of the medication. The ideal temperature for naloxone is between 68 and 77 degrees Fahrenheit. However, it is a fairly stable drug. The shelf life of naloxone is 2 years from the manufacture date of the drug. Your department should seek medical and legal advice in advance of deploying naloxone to develop policies and procedures for individuals who refuse additional medical treatment. An overdose situation can be chaotic. Medication may spill, and the administration of naloxone may not go smoothly. In the event that some of the liquid medication spills out while attaching the atomizer, simply administer the remaining amount. It's ideal to administer the medication in both nostrils, but if the medication is inadvertently given through only one nostril, it will still be effective. With the intranasal application, it is less likely that the subject will become combative upon an abrupt return to consciousness. Naloxone was proven effective in an Ohio pilot program. On October 15, 2013, Governor John Kasich signed Ohio Senate Bill 57. This enabled Lorain County emergency responders to conduct a 1-year pilot project to administer naloxone to individuals suffering from an apparent opioid overdose. This project was named Project Dawn, Deaths Avoided with Naloxone, and the Lorain County Narcan Task Force was established. Since its inception, there have been 14 police departments with a total of 510 responders qualified to administer naloxone in the event of an opioid overdose. As of March 2014, police officers in the Project Dawn initiative have administered naloxone to 32 opioid overdose subjects. 30 of those recipients were revived. This completes the Ohio Attorney General's training and education program for naloxone. Thank you for your attention.